Hello everyone, I am Dr. Niti Raizada. I am Senior Director of Medical Oncology and Hemato-Oncology at Fortis Group of Hospitals at Bangalore. I want to talk today about cancer prevention and cancer vaccination. We are talking here about cervix cancer, and this is one of the interesting cancer in which vaccine has been devised to prevent cancer. And well, yes, virus is the etiology for which this vaccine is developed. It's a gigantic success story in medical research because this is one cancer which can be prevented in 80-90% of the chance by a vaccination which is given either twice or thrice in a lifetime. Well, the virus of concern here is human papillomavirus. What we need to know is that cervix cancer is one of the leading cause of cancer in rural India. Almost 1/4 of the entire global burden of this cancer is in India alone, and developing countries like ours also have a very high death rate. So this human papillomavirus has two important strains, that is strain 16 and 18, and we have various vaccines, most of which cover this two subtype, that is 16 and 18. But there are three types of vaccination. One is 2-valent vaccine, one is 4-valent vaccine, and one is 9-valent vaccine. Until now, India had a major economic burden by incorporating this vaccine in our routine vaccination program. But with the support of DCGI and with public-private partnership, we have local brands which have remarkably cut the cost and therefore a remarkably reduction of burden on the healthcare system in our country. Well, this vaccination is started at 9 years of age. The most common recommended age group is 10 to 11 years of age, and before 15, if this vaccination is given, it is given in 2 doses, which is 6 months apart. So at 0 and 6 months, that is the dose recommended. However, between 9 and 25 years of age is the routine age recommendation for this kind of vaccination. This is definitely recommended in women, but also in men, that is young boys as well need to be given this vaccine. And why so? Well, genital warts happen in both men and women. Cervix cancer is definitely the most common cancer which is prevented by this vaccination. And of course, other cancers are in women like vaginal cancer and vulvar cancer. But when we talk about men, even penile cancer has HPV as etiology. Both gender combined anal cancer also have quite a lot of incidents related to human papillomavirus. So when we talk about other strain, almost 15% of other strain confer resistance to other type of cancer. Well, we have been able to record a miracle when we talk about HPV vaccination, and in countries where it is a routine immunization program, and there's a remarkable incidence of cut down of genital warts. But whether it will turn into reduction in cervix cancer reduction will be seen eventually. But yes, the answer is that HPV happens to be a surrogate marker, and when we cut the incidence of HPV, we are likely to cut the incidence of cervix cancer as well.